Dr. David Biedebach, Caneo Chiropractic Relief Center. Here today I'm chatting with my friends from Westlake Village Methodist Church. Okay, we're friends, we've known each other a long time. I want to give you some information about age versus neglect. Which is it that causes a lot of problems for us? Is it the age or is it the neglect? Well, a lot of things are age, but not everything is. And with the spine, most of it is nothing or little to do with age. There's a big difference in terms of time. So if I take care of something, then it's exactly the same age as the body part that I don't. Well, let me explain. If I'm standing in front of you and this arm is completely atrophied, we wouldn't look at me with a healthy arm and an atrophied arm and say, well, that's normal for his age. Because there's nothing normal about that. It's abnormally responding to my age unless I have done something to make it atrophy, which must be the case, which means it isn't my age. It's because it hasn't moved in a long time. It's the same with your spine, because when you look at x-rays or MRIs and you see a fair amount of degeneration here and nothing or very little up above, they're the exact same age. So how can that be normal for the age? That's a problem, because what do we do with normal? Nothing. So we allow it to get worse. So the reality is it is not normal for the age, it's common. It's a very different concept. And the longer you do nothing about it, the worse it becomes. People assume, well, if it gets worse, I'm going to know. No, in most cases you don't, because we avoid the use to avoid the pain. And therefore, the structure from here atrophies further. Okay? Therefore, the knee, when it doesn't go to there and only to there, atrophies further. So the further it atrophies, the more the tissue on the other side becomes brittle, so that when you fall, it breaks or tears instead of just springs. So we're all going to fall. Every one of us are going to fall, some more than others. But when we fall, if I was falling to my knee and it goes all the way to here, but my knee only bends this far, I've just torn it. But if I go to here, I've just bounced right back up. Or just a little bit of tenderness and I go on. If I reach for something as I fall and my arm will only go to here, then it tears. And now I'm a surgical case. Or possibly a surgical case. The point is, these tend to collect through our lives. And the more often we're told it's normal for the age without how to fix it, which you have to know, because seeing the physical therapist or the chiropractor for everything isn't enough. You have to take care of it first. So like a shoulder range of motion should move very far, and you would want to stretch it. So yoga is a great exercise, but you want to take care of the injuries you have. So if you're ever told it's normal for your age, it's really more like it's common for it. Because people collect injuries they don't do much about, so we have a lot of people walking around with all these injuries. When you get a shoulder one and a hip one and a low back one, they will age you, because you have to walk more carefully. Well, that's their age. No, it's not. It's neglect. Is it age or neglect? Now, they don't mean to neglect it, but maybe they're there because they were given wrong directions. Okay? The direction would be, it's very common, we see this is what you can do about it, this is how it can be taken care of, and you really need to do it, and then we need to follow up to make sure that it's done, or you need to be with someone to get it done, but still learn from that to take care of it. And then follow up and make sure, just like a dentist does. Dentist takes a picture of your teeth, x-rays, even when you have no pain. What for? Well, you might have a cavity. So spines, people tend to take an x-ray only when it's falling apart, and even with that, a lot of times they don't take an x-ray. We're being trained the wrong way. We really need to turn this around to live a healthier life for down the way, the next 3 years, the next 5 years, the next 10 years. And the more that we can pass this on to our younger generation, the healthier they will be when they get there. And the more things that you can do in your life and the quality of life, because it really does get us down if we're losing that quality. All right? It also ages us in many other ways. And it's also internal problems, because the immune system works based on enough energy. And if you're lethargic because it's hard to move the body around, you're going to get sick a lot more. So let's get as healthy as we can be. Let's understand the difference between age or neglect. And I'm not blaming you, because a lot of times you're just told it's normal for the age. But that's not really what it is. It's common for age, not normal. Very different. 1 out of 7 Americans has heart disease over 50. Very common we see that. But you imagine a doctor saying to a person severely brittle diabetic, or high blood pressure. Oh, it's normal for your age. That would be horrible. So we want to take care of it. Let's take care of ourselves. Let's do it in advance. Let's jump in with our own 2 feet. Let's figure these things out. Let's make the quality of life better tomorrow than it would otherwise be. Dr. David Biedebach here to answer your questions, help you, and I hope this is helpful. Thank you very much.